Good morning, everybody. My name is Paul Bauman. I think I've taught you guys previously, but I'm the current PGY2 pediatric pharmacy resident here at the Children's Hospital of Georgia. And today I'm going to be talking about pediatric drug information. And specifically, we'll look at some specific resources, but we'll also cover some of the common questions and queries that you might receive specifically for pediatric drug information questions. So some objectives that I do have for this lecture today. I hope that all of us will be able to walk out of this room and be able to identify what type of information can be found in specific pediatric drug information resources. And what we'll specifically be looking at is disease state specific resources, but also medication specific resources. Hopefully we'll be able to employ a stepwise approach to answering pediatric drug information questions. And so, as with all drug information questions, I think that there are similarities between pediatric patients but also adult patients, but there's also definitely going to be those differences. And then finally, we'll be able to utilize appropriate resources to answer commonly asked pediatric drug information questions. And so just to begin with, as I mentioned, there's a lot of differences, but there's also a lot of similarities between pediatric drug information questions as well as adult drug information questions. And so one of the issues is that only a third of drugs approved by the FDA actually have labeling for the pediatric population. And so a lot of times we're going to get a specific indication or a specific medication for our pediatric patients, and we're just not going to know a whole lot or have a whole lot in regards to what we're going to do with that medication. And there's even less information available for those patients who are less than 2 years of age. And so some specific pediatric differences between the adult population and the pediatric population are broken very broadly down into medication-related, but then also patient-related as well. And so some patient-specific factors that we want to take into account are, first of all, just the unique kinetics of pediatrics. And so I think you guys have had the pharmacokinetic lecture for pediatrics, but just a very difficult subject, and it's also ever-changing. And so pharmacokinetics from neonates, so babies who are just born, can be very different from neonates to infants to children to adolescents. And so that poses challenges to pediatric drug information questions, but then also pregnancy and lactation questions as well. And so not only if the mother is pregnant and she's taking a medication, what sort of effect that can actually have on the unborn baby, but actually after the baby is born and the mother's breastfeeding, what sort of medication is the mother taking that's actually getting into the breast milk and affecting the patient in that mechanism. In regards to medications, and so dosage forms is an extremely important aspect of a patient's care that we need to take into account for the pediatric population. So we can't expect neonates to take full tablets, full capsules, or expect to be able to do orally disintegrating tablets. And so a lot of times we need to go out of our way and see if certain tablets, certain capsules can be crushed, opened, and sprinkled in applesauce or in formula, but then also considering other routes of administration as well. And so a lot of times we forget about the rectal route, but suppositories are a good route of administration for pediatric patients. Compounded formulations, so again, for those patients who can't take tablets or can't take solid dosage forms, and there's not a commercially available liquid product, a lot of times we're going out of our way and looking at what sort of compounded medications that we can use. So is there some sort of extemporaneous formulation that either a hospital can make or outpatient pharmacies can make? And then also compatibility. And so depending on the patient, they may have an NG tube or a nasogastric tube or a G tube. And depending on the type of medication, it might not be physically compatible just with the type of tubing for that enteral medication. But then also for our pediatric patients who only have a very limited amount of IV access, we can only access so many of their veins. We need to make sure that their TPN, their lipids, their medications that they're being administered are also all compatible in that IV line as well. So just some considerations for our pediatric patients. And so as I mentioned previously, we're going to be looking at some disease state specific resources as well as some medication specific resources throughout this lecture. And so you can see what we're going to be looking at there. So we'll go over about 5 or 6 in each group. And so just to start out with, we're going to start out with the Red Book. And I think I have mentioned this previously in some other lectures that I've given, but the Red Book is the kind of the Bible for pediatric infectious disease resources and drug information questions. So it is published by the American Academy of Pediatrics, and the hard copy of this book is published every 3 years. However, it is available both online and as an iPhone or smartphone application as well. And this is updated a little bit more regularly than every 3 years. The Red Book is broken down into 5 broad categories. So first of all, there's immunizations. And so one of the important considerations for our pediatric patients is making sure that they're immunized for those diseases or those infectious processes that can potentially be devastating to them. Care in special circumstances, and so this ranges anywhere between issues with human milk and then all the way up to sexual health for adolescent age children. Infectious disease summaries, so looking at diagnosis, what sort of manifestations of infectious diseases, as well as what sort of treatment options we have available. A review of antimicrobial agents, but then also antimicrobial prophylaxis. And so there's quite a lot of disease states and quite a lot of conditions in patients, and pediatric patients specifically, that do require some sort of antimicrobial prophylaxis. So it does have information about that as well. And again, this is a resource that's available in multiple mediums. It's available in print, online, as well as an application on smartphones. The next 2 resources that we're going to look at specifically for disease states are the Pediatric Pharmacotherapy book, as well as the Nelson Textbook of Pediatrics. Both of these resources are available in print, but then also online. And looking at specifically pediatric pharmacotherapy, is published by the American College of Clinical Pharmacy, or ACCP. And it has therapeutic reviews for each age group, and it's actually broken down and categorized by body system. So from central nervous system to cardiovascular, to pulmonary, to hepatic, to renal. So it breaks down the different specific disease states by body system. And each review, there's but pharmacotherapy review in regards to monitoring for effectiveness, monitoring for toxicities, as well as what sort of diagnosis and what sort of monitoring needs to be done for those specific agents. And the Nelson Textbook of Pediatrics, also referred to as the world's most trusted pediatric resource. It has principles of therapy and pharmacotherapy for almost and nearly every disease state in the pediatric population. So just examples, it has IV electrolytes and fluid information, it has growth and development, it has mental disorders, psychiatry disorders, it has specific disease states, heart failure, so it's a very broad resource for disease states. So good resources for looking at specific disease states that might be affecting the pediatric population. Next, we'll look at Pediatrics in Review, and this is one of my personal favorites, at least that I'm presenting today. But this is published, again, as with the Red Book, by the American Academy of Pediatrics. It's a monthly journal designed to help pediatric practitioners just keep up to date with different disease states. And I think it's unique because it's kind of a brief journal. It has around three or four review articles for specific disease states. It has 4 to 6 clinical cases, often in reference to those reviews of those disease states. And it also has an in brief section. In this in brief section, it isn't necessarily about specific disease states, but it does address issues just in the realm of pediatrics as a whole. And so just looking back at some of the past issues, it had information about ear piercing for children, new recommendations by the American Academy of Pediatrics. I can't tell you what those recommendations are, I didn't look at them. How homelessness affects childhood, what electronic cigarettes, what sort of effect that has on pregnant women and the development of the babies. But then it also has just in brief reviews about different disease states that you might not necessarily see on a very common basis. So kind of a unique article or a unique journal present, available in print, online, but then also on your phone as well. And the last disease state specific resource we're going to look at is the Harriet Lane Handbook. And so this is quote unquote written by residents for residents at the Johns Hopkins Hospital. And so this provides really good information about point of care, clinical diagnosis and information. So it has a lot of information about diagnostics, treatment recommendations for that point of care contact with the child. It has renal dosing information for specific pharmacotherapy. But then also kind of one of the unique things that it does have is it has normal pediatric labs, normal pediatric lab values, vital signs, growth charts. And so again, for that point of care contact with the child, we can see where they're deviating from the norm. And with that, you can give your recommendations as a pharmacist. It's a really good reference to kind of figure out what's normal in children, because a normal heart rate in a neonate is going to be very different than a 14-year-old child. So just good information provided with that. And this is available both on your phone as well as in print as well. And so those are the disease state specific resources. Are there any other questions or concerns with these resources? It's kind of difficult to know specifics without actually going into each one, but just kind of a broad overview of what's available to you guys for pediatric drug information questions. All right, we'll move on to medication-specific resources. So the first two we're going to look at are kind of the mirror images of each other. Just one is in print, and the others are available online as well as on your phone. And so this is Pediatric and Neonatal Dosage Handbook, as well as the Pediatric and Neonatal Lexi Drugs. And so some of the things that these resources are going to address or provide to you include pediatric and neonatal dosing, extemporaneous preparation. So again, for those products where there's not a commercially available product, and you do need a recipe, this provides recipes that are commonly known. Drug administration, so not only for oral administration, advising if it can be crushed, if it can be, if it's a capsule, if it can be opened and split up and put into some applesauce, but also IV medications, if they can be pushed or if they need to be administered over a certain amount of time or at a certain rate. Drug interactions, so not only drug-drug interactions, but that physical compatibility as well. Pharmacokinetics, and if specific pediatric pharmacokinetics are not available, they will give you the adult pharmacokinetic data. And so you will have at least somewhat of a knowledge of what you might expect with the pharmacokinetics and pharmacodynamics of that medication. And then also patient education. And so what are those key pearls or what needs to be addressed in regards to educating either a pediatric patient or the pediatric caregiver or family. The next medication-specific resource we're going to take a look at is the Teddy Bear book, or the Pediatric Injectable Drugs. And so this is published by the American Society of Health Assistant Pharmacists every 3 years, and it has a lot of information about parenteral administration of medications. And so this information is provided in drug monograph format, and so it has different sections for dosing, administration information, and compatibility. So dosing, you can see what sort of normal doses, what the normal lows and highs are for these specific injectable medications. Administration information, so again, an IV medication can be pushed, or if it needs to be administered over a certain amount of time. Compatibility information, stability information, so after a powder has been reconstituted for IV administration, how long is that good for? Is it compatible when D5W, normal saline, half normal saline? What sort of compatibility or stability information in those regards? But then also infusion-related cautions. So when administering medication through the IV route, what sort of infusion-related cautions or what sort of effects can we expect from that IV administration? So red man syndrome with vancomycin. So things like that to take into consideration. And this is also available in print as a book, but then also online as well. The next medication-specific resource we'll look at is drugs in pregnancy and lactation. And as you can tell, it's all things pregnancy and lactation in reference to medications. And so this is also published in monograph format. It has information about pregnancy categories. It has information about specific case reports and summaries of studies. And so it has a paragraph format in regards to referring to specific patients who receive that medication while they are pregnant or lactating. There's also a quick reference appendix for seeing what sort of classification, pregnancy classification, certain medications are. And as you can see from that picture, it's available in print, online, as well as on your phone as well. And then the last medication-specific resource we'll look at is NeoFacts. And I think on one of the previous exams, I put an exam question where we actually utilized one of the charts that we can find in NeoFacts. But NeoFacts is really the reference of choice for neonatal prescribers for neonatal dosing of medications. And so it's age and indication-specific drug dosing calculators as well as charts. So you can see from that chart on the left that for this specific medication, it takes into account post-menstrual age, so the amount of time it actually took to conceive the baby, leading up to when they were born, but then also taking into account after being born and where they are currently. Postnatal age, the amount of time it takes when they were born to when they are now. And then it kind of spits out that interval for you, so you can see how frequently you're going to be dosing this specific medication. One of the important things to consider, especially for our neonates, is nutritional aspects of their care. And so this has a lot of information about specific enteral formulas in regards to the different types of nutritional formulas available. extemporaneous preparations, and then also drug administration as well. It's available online, in print. It's also available as a smartphone application, and it is continually updated. And so when new information does come out, they do update what sort of recommendations that they do have in their resource. And so any questions about disease state-related resources or medication-related resources? Okay, so we'll move on to how to approach a drug information question. And I know that you guys have already kind of had different sort of lectures in regards to pharmacotherapy and also pharmacokinetics, so you have an introduction to it, but similarities and differences with the adult population. And so really, the most important thing that I can think of is identifying patient-specific factors. So as with our neonates, so identifying what their age is. So not only their gestational age, but their postmenstrual age, their postnatal age, their weight, so taking into account how many kilograms, making sure that that's accurate. So there have been medication errors that I've nearly witnessed for a wrong weight, either it was too high or too low, so the patient was either going to receive a dose that was too large or too small and not receiving effective therapy. What sort of conditions the patient has, so what the medication or what the drug information question is going to be related to, but then also what sort of drug, condition, or disease state interactions that we might be able to expect. And then also what other sort of medications is the patient receiving. So again, taking into account that compatibility issue. And then after you have kind of a full view of your patient, gathering information from multiple sources. And so, again, there's just not a whole lot of information. It's just kind of the nature of pediatrics in regards to dosing and things of that nature. And so it's really wise if you can't find the information from a single resource, to do your due diligence and look at multiple resources to come up with that information or to come up with your recommendation. And so after you look at multiple resources, actually coming up with your response and giving that response to the prescriber. And so with that, we'll go ahead and get into some sample pediatric questions that you might receive, that I personally received, that some other pediatric pharmacists, residents have received in the past, where we actually have to utilize our drug information resources in order to answer these questions. So the first prompt, right before the pharmacy closes, you get a phone call from a worried mom. She picked up brand name sulfatrim suspension today for her child, but when she drew up the first dose, she noticed that the medication was a red liquid. She forgot to tell you that her son has an allergy to red dye number 40. And her question to you is, can he still take this medication? And what online references could and would you use to help answer this question? So I would appreciate some audience participation if you have an idea of what you might expect. Now I know you guys have group numbers, so I will call on group numbers if we don't end up getting some responses. Anybody from Athens have an idea?
What about the package insert?
Yeah, and so that's not what I have on the slide, but that was gonna actually be one of my, you kind of stole my thunder, but yes, package insert is something that you could look at, and that's another place that you can go to that oftentimes we are led to going to. So yes, very good. You definitely stole my thunder. But one of our resources that we can use is pediatric and neonatal epilepsy drugs. So if you actually look in dosage forms and look for this specific sulfatrim formulation, we can see, I'm sorry, that's a little small for you, but we can see that red number 40 actually is present in the suspension. And so with this information, knowing that the patient has an allergy, we could potentially reach out and find out what kind of allergy the patient had when they received red number 40. But perhaps our recommendation would be to not administer this medication because it does have this red number 40 dye in it. Very good. All right, next prompt. It is your first day on your general pediatrics rotation, and you get a patient who is admitted to your service with nephrotic syndrome. Your preceptor asks you to find a review article to read on the disease state so that you can discuss it tomorrow. What online reference could you use to find a review article for nephrotic syndrome? Yep, perfect. So over here in Augusta, we had a pediatrics review. And so this is a really good resource, one of my favorites that I like to look at, but has a really good resource for just quick reviews for disease states, but it also has those case reviews or those case studies that you can actually look at that refer back to those review articles. And then what about a hard copy reference could you use to help find this review?
Textbook, Nelson, textbook,
Yep. So we can also use the either pediatric pharmacotherapy or the Nelson textbook of pediatrics. Alright, so your next prompt. You have a 3-year-old pediatric patient admitted to your service who is diagnosed with tuberculosis. Isoniazid will be part of her drug regimen, but your hospital only has tablets on formulary. You need to find a compounding recipe for the extemporaneous preparation. What online reference could and would you use to help answer this question? So can I get a response from Savannah? So over here in Augusta, we have pediatric and neonatal Lexi drugs. And so if you look at isoniazid on the specific drug information resource, we see that there is an example and that there is a section for extemporaneous preparations. And so you can see exactly how this specific resource actually compounded this medication. And so I personally didn't have to deal with this, but to my knowledge, in our children's hospital, we had one of our PGY2s last year come up with this recipe for a pediatric patient who had tuberculosis in order to utilize it. All right, so your NICU team wants to start cefotaxime for sepsis on a 3-day-old baby in the nursery, and their gestational age is 38 weeks. They come to you for a recommendation on what dose and frequency to prescribe. What online reference would you be able to use to answer this question? What about somebody from Albany?
Neofax.
Yep, perfect. So one of the most trusted resources for drug administration for the neonatal population. And so this is the chart that you would get if you look at cefotaxime underneath and the dosing, the actual doses and the frequency. So with this patient, we know that the gestational age is 38 weeks. So we can see that it either fits in all weeks or 32 weeks or more. However, we also see that the postnatal age is younger than 7 days. And so our recommendation to the NICU team would be 50 milligrams per kilogram per dose every 12 hours. And then what hard copy reference could you use to help confirm this answer? And so we could use the pediatric pharmacotherapy that might have some insight into drug dosing and efficacy and monitoring parameters. Some other hard copies that we could use on pediatric injectable drugs, as well as the pediatric and neonatal dosage handbook. And then I don't want you to think that Lexicon or the pediatric and neonatal Lexi drugs doesn't have neonatal information. It certainly does, and when there's not a whole lot of information on neofax, sometimes that's what we rely on. But again, one of the important factors in regards to looking at multiple resources in order to come up with your response to drug information questions.
Dr. Bowden?
Yes?
Would you also be able to use the Red Book for
Yeah, you could also definitely do that. So I'm not sure what that would look like in the Red Book, what terms of dosing information or how a chart would look. So I would definitely think so. The Red Book has a lot of information about the actual disease state. So perhaps if you knew what your NICU team was treating, you could go to that section in the Red Book and see what sort of dosing information is available in the Red Book.
Thank you.
Yeah. All right. Next prompt. A mom comes into the retail pharmacy to fill a new prescription for sertraline. She has a newborn in her arms, and when you ask, she states that she is solely breastfeeding. Can she continue to breastfeed while taking sertraline, and what hard copy reference would you use to be able to answer this question?
Drugs in pregnancy and lactation.
Yep, that was an easy one. So all things pregnancy and lactation, you could use this resource. It's available online. It's available hard copy. It's available on your iPhone as well. Next question, a 3-week-old comes into the pediatric emergency room in status epilepticus. The intern on the team wants to give a load of Keppra via IV push. Is this a viable option for administration? And what electronic reference could you use to help answer this question? What about somebody from Athens?
Peds and neonatal Lexi drugs.
Yep, perfect. And so if you look under the pediatric and neonatal Lexi drugs and you look under the administration section, we can see that it can be infused over 15 minutes. However, it does give a specific dose and rate of administration for status epilepticus. So 2 to 5 milligrams per kilogram per minute has been recommended for this specific scenario. And we can also see that in neofax, it also provides some administration information as well. And then, so same prompt, but what hard copy reference could you use to either help answer this question or perhaps confirm your response? Yep, and we have a response over here to guess that, and it would be the teddy bear book. So this has a lot of information in regards to monograph format for administration and dosing of medications. All right, a 5-day-old in the NICU was found to have disseminated herpes simplex virus with central nervous system involvement. They are already on intravenous acyclovir, but the team would like to know what an appropriate duration of IV therapy would be. What hard copy reference could you and would you use to help answer this question? So I think I heard it here, but what you could use is the Red Book. And so the Red Book, again, all things pediatric infectious disease, has a lot of really good information. So we could use the Red Book. And then our last prompt, but you're working in a pediatric outpatient renal clinic, and there's a 9-year-old male with a blood pressure of 125/76. In order to determine if his antihypertensive regimen is appropriate, you need to know what a normal blood pressure is for his age. What hard copy reference could you use to help answer this question?
Harriet Lane.
Yep, the Harriet Lane textbook. So a lot of really good information for that point of care, diagnostics, lab values, vital signs, and things of that nature. And so we actually have, I just came from our pediatric nephrology clinic, and so we actually have a copy of this. And so every patient comes in and gets their vitals checked, and with nephrology, one of the things that we're concerned about is blood pressure. And so we do refer to this quite often, and we have charts all over the walls. So from experience, I can tell you that this is a very good pediatric reference. And that's what I had to do for you guys today for pediatric drug information resources. Are there any questions? And this is by no means all-inclusive list of all the pediatric information resources. There's a lot more out there, different journal articles, different types of textbooks, but just kind of a review of some of the ones I've had experience with that have been beneficial for me. So any questions? All right. Well, thank you guys so much. I think I'm going to let you out of the way. And if you do have to have some questions, feel free to